All right, so lifespan development. Did we lose somebody? No, Kim jumped off the.
So.
No, we're good. Her camera was turned off. That's why it shrunk my screen a little bit. There we go. All right, let me just break these down, and we shall get started. Let me get my pen out so I can circle things. All right. Get past all these things here. All right. So lifespan development. Depending on which class you take, this could be a full semester of education, or we can kind of cram a lot of this and break things down to easier levels and cover it over the next hour. So humans develop throughout their lives, right? Start from infancy, so newborn, 0 to 28 days or 0 to 30 days, working their way through pediatrics and through the adolescent years, growing up into middle age to the elderly. And we're going to learn about how things change throughout that time. So EMTs must be aware of the physical changes a person undergoes at various stages of life. And this is going to be very important to us to have an understanding of what's truly going on. Obviously, blood pressure changes, heart rate changes, Old Orchard Beach pier fries, things that we're going to be eating lots and lots of, right? That's what putting hot dogs, all this bad stuff we put into our body that makes our body no longer a temple anymore, right? And this is what's going to be changing, and it does change a lot what's going on. And as we get older, we start to deteriorate more problems occur, osteoporosis, osteoarthritis, moving into the rest of life. So this may alter the approach to patient care and how we deal with things. So it's good to understand, okay? And so in chapter 33, we're going to be covering neonates, but the neonate and infant stage, okay? Neonates are birth to 1 month. I would highly recommend writing down a few of these, neonate being one of them. And the reason being is that neonatal resuscitation is different than what you learn in AHA CPR. We do not teach neonatal resuscitation. That is a whole separate class that I don't think I've ever seen an EMT or an advance actually pass it before. It's usually for paramedics, nurses, physicians, pediatricians, things like that. They think what they call an NRP program. So I don't want to get you guys into that, but what you need to know is that neonatal resuscitation is a 3-to-1 ratio. 3 compressions to 1 breath when they are currently in cardiac arrest. So infants are now from 1 month to 1 year of age. And this is where you start seeing them develop at a startling rate. They start seeing them move quickly as far as growth goes. So we're getting more into that here. So one of the things right now is weight. And weight is very important. Because everything we do is in kilograms, which means you have to understand how to convert them. All right. So I'm going to do the best I can here. All right. So you're going to do, that's actually a divide. You're going to divide by 2. All right. And then you're going to take off. All right. 10%. Whatever it may be. That's going to be your easy equation. If you have a calculator, take the weight, divide it by 2.2, and that's your kilograms. Okay. Everything we do in the pediatric world is weight-based. Everything we do, weight-based. All right. So if I say that a patient weighs 200 pounds, that's a 0, I promise you. All right. Divide that by 2 equals what?
90.
Well, 100 to 200.
100.
Oh, minus 10%.
Right.
Yeah.
Subtract 10% equals 90, right?
90.
So how did we get that?
Well,
10%, but 10%. All right. Remember, you might not have a calculator with you, or you forgot your phone at home in the back of an ambulance. Okay. And weight's also going to be very important as well when you're talking about flight, right? Because they're going to want to know a patient's weight so they can burn off the fuel in their helicopter to be able to make the weight of the helicopter to be able to transport. Okay. 1 second here.
So why aren't you just dividing by 2.2?
Because if you don't have a calculator, how can you divide by 2.2 and be accurate?
Gotcha. Okay.
Right. So I'll show you the 10% thing here in a second. So when you divide 200 divided by 2 is 100, 10% is going to be on a 3-digit number, the first 2 digits. Right there. So you subtract 10 from 100 is 90. You got a patient that weighs 300 pounds. Okay. Divide that by 2 is 150. Right? Minus 15.
135. Yeah.
135. Quick math. Right? You got a patient that weighs 50 pounds. Divide by 2 is 25. Because it's a 2-digit number, go by the first number, the 2. So it'd be 23 kilos.
You mean 23 pounds?
23 kilograms. We're converting pounds to kilos.
Oh, yes. I'm sorry. I went
That's fine.
backwards.
Good. Right. So that's how we convert stuff over. Right. We're talking about street medicine. Okay. We really don't have time to break out calculators and everything else. So divide by 2, take off 10%, and that's going to be your number. Now, if you're a 300-pound patient, you're off by 2 kilos, it's not going to make a difference in the medications we're giving. But do it to a pediatric or an infant, and that can be the world of a difference of flooding a patient with fluids. Right. You got to mark ins and outs. So we'll talk more about that in the advanced class. Right. But for us, simple weight. Pounds divided by 2, take off 10%. Right. And that's going to be it. Now, if you have a patient that weighs 15 pounds, divide that by 2. Right. Which would be what?
7.
So, yeah, 7.5. Right.
7.5.
So it'd be right around 7.5. It'd be 7.5 kilos. Right. There's nothing really to determine the 10% of that.
Okay.
So neonates weigh roughly 6 to 8 pounds or 3 to 3.5 kilograms at birth. The head accounts for 25% of the body weight. So why would that be important to understand? The head.
They fall.
Right? They're top heavy once they start walking, but right now they're not. Here's the thing. With a neonate infants, okay, a couple things are happening. One, their head is proportionally larger than their body versus an adult. And 2, their trachea doesn't have the cartilaginous rings fully developed at this point in time, so their airways are more pliable. So with their head being bigger, accounts for that body weight. 1, they're top heavy, and 2, if you lay them down on their back, their trachea closes. Which is why you got to pad underneath the shoulders. They grow about 1 ounce per day, and the weight triples by the end of the first year. So after week 2, the infant grows at a rate about 1 ounce or 30 grams per day, doubling their weight the 4 to 6 months and tripling it by the end of the first year. So why is this important for us to know? When we're doing our assessment, to make sure you're asking these questions, other than medications.
Well, a baby that's grossly underweight, malnourished.
Perfect. That's where I wanted you guys to go with this, right? Are they malnourished? Are they not getting what they need to grow, right? And then the question is why aren't they? Do they have a medical diagnosis, or the family just not taking care of them? Right? And we got to be able to pick up on these different signs, right? And we got to make sure that we report the stuff that we need to report. That's why it's so important. Right. You guys get all that math I put on there?
Mm-hmm.
Really got to buy a better trackpad or something other than this. I can probably write things down better. All right. So the cardiovascular system at birth, a neonate makes a transition from fetal to independent circulation, right? So the pulmonary system, prior to birth, a neonate's lungs have never been inflated before. So their first breath is facilitated in part by the chest passage through the birth canal, and then increases in intrathoracic pressure from there, right? So when we have a delivery, we're going to cover more of this in obstetrics and delivery. We want to make sure we activate and stimulate the breathing process. And one of the things we're going to do is we're going to suction first before we stimulate. Because if we stimulate and then suction, Now they're going to take all that mucus and everything else, and they're going to inhale it into their airway. Now we're going to cause more of a pneumonia or things like that. We don't want that in an infant and neonate, right? So as they come out, we suction the mouth first, the nose second. Think of the alphabet MN, right? Mouth first, nose second. Once we suction that, hopefully that will stimulate the cry. If they don't start crying, we start flicking the soles of their feet for a stimulation with our fingers. And that should stimulate an infant to cry if they're not crying or breathing at the initial birth. But that doesn't work, then we go to BVM and we start working different things from there. And we'll cover that more in neonatal care. But I kind of wanted to go over that. So again, their first breath is very important. We start inflating these lungs. We start hoping we hear that very healthy cry. So infants younger than 6 months are particularly prone to nasal congestion, which is why having those turkey basters, that's what I call them, but having the bulb syringe, right, are very, very useful. The last thing we want to do is stick it. Exactly. They work way better than grabbing a yank cower and shoving it up a kid's nose, causing more damage, right? And they're more portable too. Infants have proportionally larger tongues and proportionally shorter, narrower airways, which we just talked about, right? So the airways are smaller, they're shorter, and they don't have the cartilaginous rings that make them solid like we do as an adult. So they're more pliable, and pliable means that they're going to collapse depending on positioning of the airway, right? So airway obstructions are definitely more common for this. The rib cage is less rigid, and the ribs are sit horizontally, right? Less rigid is a good thing for them because they bounce. They bounce a lot better when they fall. If one of us were to fall right now, we kind of just lay there and say, yeah, I'll get up in about 15 minutes. Give me a Tylenol. Right? So we look at that kind of stuff too.
Get me a crane.
Give me a crane, I'm going to get up. So for bag mass ventilations, remember the infant's lungs are also very fragile, right? So if we overinflate a lung, what's going to happen? Hold on one second. Sorry about that. All right. So remember the infant's lungs are fragile. So if you overinflate an infant's lungs, what's going to happen?
I'm gonna take a guess. Maybe it'll like pop or damage it
Yeah.
or something.
Yeah, attention pneumothorax. You can pop a lung. Overinflation.
It'll pop like a balloon, right? I mean, what would?
Well, they're kind of like balloons if you think about it. The air's got to go somewhere, and if the lungs don't pop, where does the air actually go then? In the stomach.
Yeah.
Yeah.
Oh yeah, it could go down the other way.
So know what happens now when we overinflate the lungs and you start inflating the stomach, pushing pressure on the thoracic cage where the heart is, right? Think about what the longer term effects are going to be with that, right? So again, we don't want to pop a lung. So what we try to do is look for chest rise. So in a neonate, if everybody were to take right now and put air in their cheeks, like fill their cheeks up, that is the amount of air that can fill an infant lung. That's it. It's not much. Putting that in perspective, right? When we start talking about the same thing with neonates in blood loss, right? How much blood is in a neonate to an infant? Roughly about a can of soda. That's about it. Right? It's not much. So it doesn't take much to become hypovolemic for these infants either. Infants and pediatrics can become hypovolemic quickly. You think about 1 to 2 cans of soda as far as the volume size, that's all these kids have versus us, where you take, 3 2-liter bottles of soda, and that's what we have for our blood supply at 6 liters. Kind of put things in a liquid perspective with that. I don't know why I just got muted again. So the nervous system continues to evolve at birth. So a neonate is born with certain reflexes. One called the Moro reflex or the startle reflex, where a neonate is caught off guard and opens his arms wide, spreads its fingers, and seems to grab at things. Okay, that's what they call the Moro reflex. So the palmar grasp occurs when the object is placed in the neonate's palm, which is what we want to happen, right? So if you have a pen, see if the neonate will grab the pen and hold on to it. Right? We're actually doing a neuro assessment with this. There's something called the rooting reflex. Is when something touches a neonate's cheek, and he will turn his head towards the touch. So when we do a neuro assessment of the nervous system, we look at the Moro reflex, the palmar grasp, the rooting reflex, and then a sucking reflex occurs when the neonate's lips are stroked. So you just take your finger, your gloved hand, stroke the lips of a neonate, and they should make that sucking motion. All right? That's what we want to see. All right. Why is it not switching over? There we go. So fontanelles. So fontanelles are spaces between the bones that eventually fuse to form the skull. Okay. So the posterior fontanelle fuses by 3 months, and the anterior fontanelle fuses between 9 and 18 months of age. So these are two important things with fontanelles. One, you want to feel the fontanelle on the top of the head. Do not push on it. Remember, you're pushing into their brain. Okay. Rub your finger over it. Right. If the fontanelle is depressed, I'm not talking about a small indentation, like literally indented. Right. What would that indicate based on your reading?
Dehydration.
Correct. Dehydration. What would it mean if the fontanelle was bulging?
Swelling.
Yeah, or increased intracranial pressure.
Pressure. Yeah.
So these are very important on part of your pediatric assessment. And we will go more in depth on pediatrics when we get to that point. On more and thorough PAT assessments, which is called a pediatric assessment triangle. Getting into that. So this figure here shows the two fontanelles, the front being the anterior and a posterior being the back. So what you're seeing on this, okay, is you have sutures that run down through here and here, and I'm talking about, these are not like, sutures as you see with thread, but actual sutures that hold everything together. These are not fully developed at this point in time because our heads are going to get bigger. This allows for the head to expand. Once we get to a certain point where our head is fully developed, these sutures start to form, the fontanelle goes away, right? And it becomes straight across like this, right? So that's going to end up changing. So again, fontanelles, right? 3 months, the posterior, up to 18 months out back. Now there are other ones as well, the sphenoidal. So right here would be the sphenoidal fontanelle, located here. And then we also have the mastoid fontanelle, which is located more towards the occipital region. So do you guys remember all this from A&P? Right? So up here would be the frontal. Out back is the occipital. You guys remember those different sections of the brain? Right? We have the temporal. All right. So by 2 months of the age, infants then can track objects with their eyes and recognize familiar faces. Hopefully they'll understand mom and dad. Familiar faces like that, and they'll track things. So if you take your hands and make a snapping sound like that, apparently my dog wants to come over when I do it too, right? but move it to their face. Go on the side of the head, snap your fingers each side of the head, right? What you're going to see, hopefully do is have them follow that command. That means that they're neurologically tracking. At 6 months, they can sit upright and they begin to make the cooing and babbling sounds. Those are the fun ages there. And at 12 months of age, an infant can walk with minimal assistance and knows his or her own name at that point. Right now, they start to walk. What happens when they start walking when their head's proportionally larger?
They topple.
They topple over and fall down. Exactly.
They're not weebles.
Nope. So the immune system maintains some of the mother's immunities, right? And a lot of times this also helps receive via breastfeeding. So mothers that choose not to breastfeed, they really can't receive a lot of those antibodies, right? When they go to strictly to formula. That's why breastfeeding was so important. Infants can also receive the antibodies as well. That's what we we're talking about before. And it helps bolster their immune system from there. So these are some of the psychological changes. A little bit bigger so you guys can see it better on your screen. All right, looking at 2 months, working your way up to 12. And if you go to your books, it's table 7.2. You can kind of see it on there as well. But these are more noticeable characteristics at the various ages. And leave this here for a minute. We kind of went over these a little bit already. More of a review. All right. Some psychosocial changes would be crying, which is the main method of communicating distress. A crying baby is a good thing. All right. Maybe not if we're parents, we want them to stop crying. But in the EMS field, crying is good. Why?
It means they have.
It means
Oh, why is crying good?
they're breathing.
And
You have an airway?
their airway is patent. A good forceful cry means that they're breathing and their airway is patent. That's what we want to see. All right. Here's some other things. Bonding is based on a secure attachment. Anxious, avoidant attachment is found in infants who are repeatedly rejected. Right. As you start seeing that and they become anxious or they don't like being attached at that age, then something else is going on in the family, inside the family. Right. Separation anxiety is also very common as well in older infants, and also trust and mistrust involves an infant if its needs to be met. This is good information. What happens if you have an infant who is not feeling well and they cannot be consoled by mom? Are you concerned about that or not?
Yes,
Why?
because there's something obviously going on.
Exactly. There's something else going on that we don't see at this point in time. Kids should be able to be consoled by their parents. Should be able to. And if they're not, then they're sick. Okay, there's something else going on that we need to look at. The other thing too, if they're listless and not moving around, those are your sick kids. Listlessness or that lethargic infant, right? That normally would be active is a huge problem. Okay. Again, I'm not going to get into detail on pediatric assessment too much. We'll do more of it when we cover peds. Right. So trust and mistrust. Remember, we talked about that by 18 months, which involves infants need to be met by his or her parents or caregivers. Another thing about infants and neonates, especially getting into peds, is they have to be able to trust you. I always do my assessment toe to head with them to kind of gain their trust, especially when they start getting a little bit older, start getting in the toddler phase. The last thing they want is someone like myself or anybody else who they don't even know start grabbing their head and assessing them. Right? I always start with tickling the feet. Why? Well, it's fun to tickle kids' feet. And two, we're actually doing a neuro assessment by doing so. So we can actually kill two birds with one stone on that. So the cardiovascular system of a toddler, so 1 to 3 years of age, or preschooler 4 to 6, is not dramatically different from an adult. It really isn't. We'll cover that here in a second. All right. Preschoolers 3 to 6 years of age the heart rate will be 80 to 140 beats per minute. 80 to 140 for preschool. Right? So if you have a preschooler, a 4-year-old, has a heart rate of 110, would you consider that tachycardia? Yes or no?
No,
I think Kim just said no.
no.
It's not, because in adults, anything over 100 is tachycardia, but in a kid, in a preschooler, anything over 140 would be considered tachy. This is their normal pulse range. Okay. So if I think, now I started seeing 110, 120 in an adult, I think, oh, maybe it's trauma, maybe it's sepsis. You know, I started thinking about a lot of those different things. Right. But in an infant, I'm not overly concerned about that because it's within their normal range. The respiratory rate is between 20 to 25 breaths per minute, and its systolic blood pressure between 80 and 100. Now, if I had a systolic blood pressure of 80 over 42 in an adult, would I be concerned?
Yeah, that's the problem.
Absolutely.
Very.
So, yeah, because now we're talking about hypotension and potential lack of perfusion based on their mean arterial pressure, right? But in a pediatric or a preschooler, that's normal. So again, you have to have an understanding of general idea of these ranges, but you're going to see these things on a quiz. You're going to see these things on exams. And when you go to pediatrics, that's a huge section of your national registry is pediatric assessment. So know these numbers, okay? And kind of put them into perspective, right? Toddlers and preschoolers do not have well-developed lung musculature, and are unable to sustain deep or rapid respirations for an extended period of time. Which is why it looks like they're compensating, but they can compensate for so long, and then it drops quickly. And I mean quickly. They deteriorate very fast. Weight gain should start leveling off at this point. The loss of passive immunity is one of the most impactful physiological changes at this stage of the human life. Neuromuscular growth makes a considerable progress at this age. Right? Now they become that sponge, and we have to be careful what we say around them. Right? YouTube is the death of me. I never should have done that. Right? Kids and electronics. Oh boy. And they learn everything from the internet, and they shouldn't be. And becomes dangerous. The average age for completion of toilet training usually is 28 months. Some psychosocial changes, they learn to speak and express themselves. So the older they get, the more expressive they get. 7 years old going on 25. They master the basic language, okay? And their basic language they're mastering is also the words that you utilize at home, right? Interact and play games with other children. They begin to understand cause and effect. Like if I touch this flame, it's going to hurt. Probably shouldn't do that. And that's about 18 to 24 months. And children learn to recognize gender differences by observing their role models. All right. 6 to 12-year-olds, these are more your school-age children now in this age group. The physical traits and functions continue to mature at a rapid rate. So physical traits, functions, we look at all that kind of stuff as well. They become more modest to themselves. They don't like being seen without their clothes on. So doing an assessment like on a 12-year-old or 11-year-old, they start making some of those characteristic changes, right? They become more shy around like male providers. Maybe they want another female provider with them, right? And if you do have to take their clothes off or have any part of an assessment, have mom or dad around, or whoever they feel comfortable with. More likely mom if the mom's around. If not, then dad or a parent usually helps. The growth of about 4 pounds or 2.5 inches a year. They start getting some of their permanent teeth, and their brain activity starts to increase on both hemispheres, so right and left. Our brain, remember, keep in mind that we have 2 hemispheres, right? Right and left hemisphere. As far as the psychosocial changes, children learn from various types of reasoning, right? And they do like to bargain with you. Pre-conventional reasoning, children act almost purely to avoid punishment. and get what they want. So they're going to try to bargain with you, or they'll try to find a way to get out of any kind of punishment they have. Conventional reasoning is children that look for approval from their peers in society. Post-conventional reasoning, children make decisions guided by their conscience. And children begin to develop their self-concept and self-esteem at this age as well. So kind of keep that stuff in mind. 12 to 18 year, these are adolescent or teenagers. Right? Vital signs now start to level off. If you notice, for an adult, is very identical to the teenagers. 60 to 100 beats per minute. Respiratory rate of 12 to 20. And systolic blood pressure between 90 and 110.
Kevin?
Yeah.
Hey, I had a question. Whenever
fine.
you look at any a lot of the tables in the book, and they talk about blood pressure, and they always from almost all the ones that I've seen, they always only give you the systolic. They don't give you the low end. Why don't they
Diastolic.
do that? Yeah, why don't they give that number?
So the diastolic is very important, okay? And we'll cover more of that when we start getting into the medical assessment itself on diastole. But what they want to show you is the systolic blood pressure is the pressure of the arteries, again, with pressure being, the system being pressurized, right? And that's an important number for us as well, right? And that's what's going to help perfuse. So that systolic blood pressure is your ventricle squeezing, pushing that blood into the systemic circulation. That's why we go with that number there. While that's refilling the depolarization phase of the heart, where the ventricle depolarizes and allows the blood to refill that chamber, that's your diastole. That's okay, because now you're not seeing any more pressure through the system. Does that make sense? And this is all coming from the left side of the heart.
Yeah, no, I know what systolic and diastolic was.
Okay.
But when we talk about it, we always have a systolic and a diastolic, and that's we say that's the range of an adult. But in the books, like I'm looking at table 7-1.
Yeah, I don't have that in
has,
front of me, but I'll go with it.
yeah, it just literally says systolic blood pressure for adults
Yeah.
is 90 to 130. It doesn't have the diastolic. And I found that a lot of them are like that. A lot of the tables in the book are like that. They don't have the diastolic with
And
it.
I'm not sure why they do that. Diastolic pressures are still are very important, but not as important as it would be for the systolic blood pressure. All right. They're both important, so don't get me wrong.
Yeah, no, I hear you. All right, thank you.
Yeah, there's still both important factors of this. And I'm not sure why they don't put this in here, but for an adolescent, 90 over 60, 110 over 70, 120 over 80, those are good numbers, right? And the pulse pressures are the differences between. So let's say I had a blood pressure of 110 over 70. 110 minus 70 gives you that pulse pressure in between, right? We want them to be like 30 or 40 of a difference, right? That's kind of like our number. This is more ALS stuff we look for. And we see the widening pulse pressures, right? We're not getting good pump and good flow, right? But if we're seeing narrowing pulse pressures, what would that mean? What would that be indicative of? And we just covered this in shock.
I was just going to say in shock.
It would. But what specific type of shock are we talking about? And what is that an indicative of looking at specific triads?
Like the
Decompensating.
Is it the Beck's? That,
It is.
Oh,
Yeah.
the Beck's
Jason,
triad.
you're right. Yeah, it is Beck's triad, right?
Oh, right here.
That's why it's also important to
Cardiac
understand what cardiac tamponade, yes. So you have a tamponade or an like a fluid around the pericardial sac, right? There's more of a review from shock, causing those narrowing pulse pressures, JVD, and muffled heart tones. So it is important to understand both, Jason. You're 100% correct. I don't know why they only focus on the systolic blood pressure, but have the understanding of both. That's probably the best advice I can give you as far as how the book works. I'm not sure why they do it. So for 2 to 3 years, the growth spurt starts to happen. Girls finish by 16, boys by 18. I have seen boys grow above 18 years old, but it's pretty rare. But as far as that goes, the averages are 16 to 18 years old, depending on male to female. Girls generally finish their growth spurt. The endocrine and reproductive system matures at this point in time, and secondary sexual development starts taking place. So you start seeing pubic hair and axillary hair beginning to appear. Their voices start to change, and with the females, you start seeing the menstruation start. Also, acne can occur as well with this. So again, we start seeing those changes, and for some, it's going to be difficult changes for them, right? And not to mention things that are going on at school and peer pressure and all this stuff here. So we see a lot of, it comes in spurts. We start going for the meet the PD call for a psychiatric evaluation. You get there and it's a 16-year-old with depression. Okay, what happened? Well, my boyfriend or girlfriend dumped me. Okay, it's not the end of the world, right? And we had this conversation with them, or because they made suicidal ideations and threats, you have to go to the hospital. They have to get checked out by Northern Human Services for New Hampshire, and a lot of things have to happen with that, and then they get cleared to come home. Sometimes it's just something simple, or it could be an underlying deal where they have to be on medications. Again, not my deal. I'm not a psychiatrist by any means, but again, we start seeing these difference and changes. Adolescents and their families often deal with conflict now. Privacy becomes an issue. Self-consciousness increases now. Adolescents may struggle to create their own identity, right? There are multiple options for genders now that exist. Many are fixated on the public image. What are they? And they often want to be treated like an adult, yet cared for like young children. And we see that. Well, treat me like an adult. You don't let me stay out till midnight. Well, there's reasons why we don't do that, because you're 14 years old and you're a female or a male, doesn't really matter either one. And I don't want you out in the streets until midnight, right? Because things can happen. They haven't had that life experience, even though they think they've had all the experience in the world. And you got to be able to work with that as a provider, right? You can't just walk in there and tell them how it's going to be. We got to work with them. We do want to make sure we get that interrogation down, make sure we get that information from them as well for our part of our assessment. And they have to be able to put trust in you. So you got to work with it. Antisocial behavior and peer pressure peak at age 14 to 16 years old. Smoking, illicit drug use, unprotected sex, eating disorders. The code of ethics starts to develop. The eating disorders can also arise in adolescents from attempt to gain self-control through what they eat. Well, only part of the cheerleading teams, I need to lose 40 pounds, and they start becoming anorexic or bulimic, right? And what happens when you become bulimic or anorexic? What can happen to your homeostasis with that?
Your electrolytes
Yeah.
are whacked.
Oh, absolutely. Completely whacked. And especially with the vomiting, right?
Yeah.
Making
Yep.
yourself vomit. Well, you're also losing a ton of potassium, right?
You
And that's
can
all
see
stuff
it in
we
their
don't want.
teeth.
Yep. All because they wanted to lose a couple pounds to make something. The code of personal ethics start to develop based on partly on their parents, right? Ethics and values are partly by their peers and then also personal experiences. And adolescents have a high risk for suicide and depression because they think that the whole world is over because Johnny broke up with Sue. Oh my goodness, the world is over, right? And they start feeling that way, and next thing you know, they're threatening suicide because they don't know how else to handle the pressure that's there, right? Which is why we need to be there to assist them. We get called for that. Don't walk in and start calling and tell them to suck it up, buttercup, and move on with your life. They need to be talked to. I'm not saying they need to be coddled, but they need to be spoken to, and you need to be able to take that time to listen to what they have to say. And simply working it out with people like that make things a lot easier. But again, we are also not psychiatrists. We do not deal with the psychological issues that people do have. So they need to be transported to the hospital and let them get the help that they actually do need by professionals. Early adults, 19 to 40 years old. Vital signs do not vary greatly. Pulse still 60 to 100, 12 to 20 per breaths. You start seeing that 90 to 120 systolic over the 70s to 80s, right? You start seeing the normal blood pressures. Now, as you get older into your 40s and 30s, if you don't take care of yourself, right, you can get early onset diabetes or turn into a full-blown diabetic. You can get high cholesterol, blood pressure issues. things like that if you just don't take care of yourself. Now, I say don't take care of yourself. I know people that are in their 40s that are overweight that have no medical problems at all. And I've seen some people in their mid 30s that have hypertension and they run marathons. Family history is also important. You have to ask that question as well when assessing. From ages 19 to 25 years, the body should be functioning as its optimal level, right? We start hitting our prime. Lifelong habits are solidified. Psychosocial changes, obviously, life centers on work, family, and stress. So during this period, adults strive to create a place for themselves in the world. They want to make themselves now. They want to become somebody, right? We start seeing that. And many do everything they can to settle down, right? There are some that don't. They want to just be a party in the rest of their lives. But there are some that want to settle down, have a family, get a great job, get promotions, people that have good life goals. Despite the amount of stress and change, this one is one of the more stable periods of life, that 19 to 25-year-old, in that range up to 40, that early adulthood. The middle adults, 41 to 60, again, we start seeing the pulses still 60 to 100, 12 to 20, and our systolic blood pressure knows how it's going up, right? So again, if we're not taking care of ourselves, we start getting higher blood pressures. We may start seeing higher heart rates, right? Which is why it's important to make sure we're taking care of. Again, I'm not going to go in depth on these assessments yet. We're going to be covering a lot of that when we get into medical. So vulnerable to vision and hearing loss at this point. Cancer incidences start to increase. Menopause occurs in the late 40s, early 50s. Diabetes, hypertension, and weight problems are very common now because our metabolism just doesn't stay the same as it was when we were 15 to 20. And exercise and healthy diet can diminish the effects of aging as well. So again, if we were working out, but then people say, well, I don't have time to work out. Life just took over. Okay. I get it, but you can do a half an hour walk a day while you're at work, things like that, whatever you can do. So there's other things that are out there, and our jobs as EMS professionals is not just pack them up and ship them off to the hospital. We're there to, give advice too and have a conversation with them, right? Treat them like human beings, not just based on a protocol book. This is what we call PFA, psychological first aid. So psychosocial changes obviously focus on achieving life goals. Readjust lifestyle as children leave home. They have to readjust. Generally, they have some physical, emotional, and spiritual reserves as well to handle life's issues. Finances become a concern now. Generally, people of this age also have the physical, emotional, and spiritual reserves to handle these life issues. They may have someone still to talk to. Their parents could still be alive. They could be going to church and talking to their religious experts that are there without getting in any specific type of religion. Middle adults may also find themselves caring for children leaving for college and or caring for their aging parents as well. So now we have either the children that don't want to go to college and stay at home till they're 40, or we have the parents who are getting older. Now we're taking care of them. So now we have added stress at these age levels where we're trying to financially take care of our parents while taking care of our children, while taking care of, the immediate family, plus housing, plus food, plus electricity, the way everything is going up with bills nowadays, and the economy being all these changes, that puts a lot of stress on these people. So we're going to start seeing more, either nervous breakdowns to anxiety attacks to patients having chest pain. Strokes can become more common at the older ages that you get as well due to increased stress. Blood pressure goes up. We're seeing our doctors more on more medications. So a lot of things we start seeing in these middle-aged. If we get into the older adults, 61 years and older, life expectancy is constantly changing. Now approximately 78 years old is the expectation of the average out there. All right. This is determined in part by birth year and obviously country of residence as well. They are often able to overcome numerous medical conditions, but may still need multiple medications to kind of help stay alive. The cardio function or cardiovascular system cardiac function declines with age, largely due to arteriosclerosis because we have all that plaque buildup now in our system, right? Heart rate, and again, our bodies are no longer temples anymore. And heart rate and cardiac output starts to decrease. Cardiac output can no longer meet the demands of the body. The vascular system becomes more stiff. The heart must work harder to overcome vascular resistance. If you think of the plaque buildup being that resistance in the vasculature, so the heart has to pump harder, therefore increasing blood pressure, increasing heart rate, right? And the ability to produce replacement blood cells starts to decline, and so does in our blood volume. So if we're losing blood cells, we're losing blood volume, right? We start becoming more hypovolemic easier. So that short sense of diarrhea, if you have 2 or 3 episodes back to back, can deplete your system of fluid, also putting your electrolytes completely out of whack. Potassium, sodium, magnesium, calcium, chloride, all the other stuff that's in your system that you need to stay alive. Right? We start seeing all those changes. The respiratory system, the size of the airway starts to increase as well. Surface area of the alveoli starts to decrease, right? Why is our alveoli so important again? What happens there?
The exchange of
Oxygen.
hemoglobin and CO2, oxygen and CO2.
Right. So it's very important for alveoli to be functioning. As we get older, we start losing surfactant allowing for the stretchiness of the alveoli. We start having alveolar collapse, right? We start losing some of that stuff. Patients that are smokers develop COPD, emphysema, bronchitis, right? Asthmatics, things like that. So there's a lot of changes that physiologically change because we didn't take care of ourselves over that time. Natural elasticity of the lung starts to decrease and breathing becomes more labor intensive at this point, right? So by age 75, the vital capacity may account to only 50% of the vital capacity of a young adult. So the chest becomes more rigid and fragile. The cough and gag reflexes start to diminish along with the ability to clear secretions. Older adults are at greater risk of aspiration and airway obstruction. Smooth muscles of the lower airway weaken, causing airway collapse and inhalation. Produces inspiratory wheezes, low flow rates, and air trapping in the alveoli. So we start seeing all that air trapping. We start seeing that emphysema, right? That's when we start seeing increased AP diameter of the chest, that barrel chest syndrome, okay? We start seeing that in those long-term emphysemic patients. Older adults are also more susceptible to lung infections, like pneumonia. And pneumonia is the leading cause of what? Or leading cause to what? We just talked about this in shock.
Septic.
Sepsis, exactly. The endocrine system, insulin production drops off and metabolism decreases as well. The reproductive system now changes to some extent. Hormone production for both sexes gradually decrease as they age, and the sexual desire may diminish with age, but does not cease. You still have it, just not the desire to have it all the time. Your digestive system, your taste sensations decrease, saliva sensation decreases as well. All right. So changes in the gastric and intestinal function may inhibit nutritional intake and utilization in the older adults. So tooth loss makes it chewing difficult, and taste sensations start to decrease with that. So you may, instead of having a steak, it may end up being a blender steak. Saliva decretion. This reduces the body's ability to process complex carbohydrates. The ability of the intestines to contract and move food diminishes. So we start seeing more bowel obstructions, right? So bowel obstructions happen and the bowel gets perforated. Then what? Where does that bowel end up?
In
Throughout
your
the rest of
system.
your system, your diaphragm,
Sepsis.
Yeah, well, it turns into sepsis, right?
Yeah.
And you have poop in areas that poop does not belong, right? Gastric acid secretions start to diminish, which helps break down a lot of those foods in your stomach. Gallstones become increasingly common. And decreased elasticity of the anal sphincter also causes fecal incontinence, right? So you start hearing them walk around, and then next thing you know, they start becoming gassy, and they, defecating themselves. It's because their sphincter tone is no longer strong anymore, the anal sphincter. So they walk around. That's why a lot of them wear Depends now at this point. They can no longer control their bowels. The renal system, the filtration function declines 50% from age 20 to age 90. All right. Renal system's important for what?
Kidneys.
Yeah, kidneys, right?
But our waste.
Yeah, it's our waste product, right? So it's detoxing ourselves. Our body is always in detox mode. It starts in the liver, ends with the kidneys for excretion, right? Or it goes through the GI tract as well, gastrointestinal tract, pushing out feces, right? But our body is detoxifying every single day. So if someone says, "Well, I don't detox," well, you do every day. You do, right? Because then, if we're detoxing without any assistance, that means that our kidneys are working, our nephrons are pushing stuff out as opposed to infiltration, right? And our liver is doing the job at the first pass effect to help start that process. So there is a decreased ability to move waste and conserve fluids when needed. So we start losing that ability to keep the fluids that we need. The kidney mass decreases by 20% with this. In the nervous system, the brain, weight may shrink 10 to 20% by age 80 of years. Motor sensory neural networks become slower. Neurons are now lost, but this does not mean that there is not a loss of knowledge or skill, right? And then our sleep patterns start changing as well. So age-related shrinkage creates a void between the brain and the outermost layer of the meninges, which provides room for the brain to move when stressed, right? So let me zoom in a little bit here, right? So we have our subdural. That's not what I wanted to do. Come back, please. Oh, never mind. I guess I can't draw on it with it zoomed in. I tried. I'm going to sit up to be able to see this a little bit closer then. All right.
Having
So as you
draw
can
and then
see,
zoom.
yeah, but I can't. I'm running off a laptop, so it makes it a lot smaller for me to be able to see.
Yeah.
When I get back home down south, I'll have a bigger computer set up. So this is the younger adult, as you can see all through. Can you see the hand moving? Yeah. Okay.
Yeah.
So as you can see, the brain is fully functional, fully expanded. I'm not going to get into each one of these little lines. Everything in here means something. We're not going to cover that in this class. I don't want to lose you. All right. So we have the subdural space. So you ever heard of subdural bleeds before? That's because you have a bleed in the subdural cavity, which is around the outside of the brain. If you notice, this is what they call a subdural hemorrhage. Hemorrhage. My goodness, I can't talk today. It's when the brain has blood on the outer layer pushing down against the brain. Okay, inside. See the brain, skull, subdural hemorrhage, torn or stretched bridging veins here. And then the meninges are up here. So what's happening is, and let's go back to the pencil now.
How is that different than a brain bleed?
But it's the same
I mean,
thing.
doesn't
But
it?
there's
Okay, the brain
but they
bleed
have
leads
there's
to the
different
hemorrhage.
types of bleeds. There's subarachnoid, epidural, subdural, right? We have different types of bleeds within the brain, and that's all depending on where it's located. And I don't have any good pictures of head CTs on here, but that, again, you guys aren't learning how to read those yet. Those are more paramedic skill and critical care. So what's happening here is that the bleed is outside of the brain itself, causing pressure to go in that direction. The skull is not fractured. You develop that bleed, and what's happening is pushing. Eventually, okay, and because it's up front here, you're going to have some significant neurological changes, and this is what they call. I'm going to draw another one to pop here. This is called midline, right? This is midline here, right? We have a hemisphere on this side, a hemisphere on this side over here. Eventually, there'll be so much pressure that this midline will do this, and it will shift over and back, putting pressure on the other side of the other hemisphere. These patients that have these happening are significant bleeds. These patients end up getting intubated and transferred for neurosurgery. Right? But again, brain bleeds can happen. We talked about age-related shrinkage creating a void space between the brain outermost layer. Right? This is age-related atrophy and shrinkage of the brain, which creates space between the brain and dura mater or subdural space. So when the bridging veins are stretched and torn, blood may start to accumulate. This can also happen with trauma. So they could have a traumatic event, smack their head here, right? Pick them up off the floor in the nursing home, put them back in bed. A week later, they're unresponsive. Well, did they have any recent falls? Yeah, a week ago. All right. Did they go to the hospital? No, we just put them back in bed. Well, they probably have a head bleed. They're going to go to get a CT, and I can almost guarantee you 90% of the time, if they're unresponsive from that, they're going to find a subdural or an epidural bleed on those on a head CT, right? Because they may have even, or if they've gone to the hospital, the same thing too. If they go right away and they have, let's say, a very small bleed to the point where it's not picked up on a CT, and a week later, it's massive. So you got to look for those signs and symptoms, right? Of altered mental status, any kind of stroke-like symptoms at all. This is what they call a hemorrhagic stroke, all right? Hemorrhagic versus occlusive, which would be a stroke in one of the arteries, all right? Does that make sense to you guys?
Yes.
Everybody good? Okay. So the nervous system, well, continuing on with this here, peripheral nervous sensation is diminished. Increased reaction times cause longer delays between stimulation and motion, as long as prolonged reaction times and slower reflexes contribute to a higher incident of falls, right? If a patient falls twice in one day for me, the second time they're going to the hospital, right? Because they no longer can care for themselves at home. I can't deem them competent enough to stay home without hurting themselves. All right, so we got to take them to the hospital to kind of have them evaluated why they keep having these recurrent falls. Could it be a TIA causing them to fall and then it resolves afterwards? Maybe. TIAs being a transient ischemic attack, right? We'll cover more of that in stroke care. But again, there's other things underlying that could be causing them to fall. It could be something neurological that we can't see. That may be something with a small bleed in the head that we can't see at all. So again, we got to be that patient advocate. Sensory changes, obviously. Go ahead.
Well, I was going to say, and a lot of times it could just be dehydration or electrolytes are off, and the
Very
blood
well.
work you can only get in a hospital setting. So,
Right. We don't carry eye stats in the ambulances that are $18,000 a piece.
so if say you went on the first call and it was a fall, and like it's documented, there's a fall, it's not your shift, but it's within that 24 to 48 hours. Is that standard policy that the next paramedics? Okay.
Hopefully they would take the patient. Usually, like when I come off shift, I communicate with the oncoming shift coming in.
Yeah.
Say, hey, we went back to this residence again for a fall. A lot of times our falls become, I'm going to call them frequent flyer miles.
Mhm.
So we're going to see frequent flyers like that. And we just had one the other day here. I can't, like I said, I'm not going to mention towns or names, where we get called for a fall and 10 minutes later you get called back again. Guess what? You're going to the hospital. So that's what happens there. Loss of high frequency hearing, also in deafness as well. Hearing loss is 4 times more common than vision losses with this. Psychosocial changes. Until about 5 years before death, most people retain high brain function. Statistics indicate that 95% of the elderly live at home, and financial limits may restrict access to healthcare or medications, and how that is true. Right? So increase for need for assisted living facilities, but again, if they can't afford to live in one, they live at home. Or a lot of people are stubborn enough that they don't want to leave. All right, to finish up this chapter, today, more than 50% of all single women in the United States who are 60 years of age or older are living at or below the poverty level. One of the most important issues that the elderly need to face is their own mortality. Isolation and depression can be challenging, right? There's a lot of challenges with that. Loss of a loved one. And then Christmas time rolls around. What happens? Depression.
Depression.
Right? Significant depression. We see a lot more suicidal ideations, suicides between November and January than any other time of the year. Thanksgiving, Christmas, New Year's, the big holiday group in the wintertime. So not only do you have what's going on with the holiday season, losing somebody, it's now snowing, which could make you depressed, and the lack of sunlight, which provides what to you?
Vitamin D.
Vitamin
Exactly. A lot of people don't realize that their mood disorders and depression they get in the wintertime because they refuse to go to a doctor. And that could be any age, even people my age, right? People in their 20s, that they feel down in the dumps and gloomy in the wintertime is because of their lack of vitamin D. Talk to your doctors, get on vitamin D tablets, or go buy them over the counter and take them. They'd be amazed at how much better you'll feel, how much more energy you'll have because of
I
it.
just bought a snowmobile.
Right, but you want to be happy to ride it.
I
I love winter.
Oh, I can't wait to get down
Okay.
south where it's warm again.
am.
All right. So let's talk about some review questions. We'll take 5 minutes. And then literally the next presentation is like 50 slides. So it won't take too long at all. So when providing a bag valve mask ventilation to an infant, the most important to remember is don't
B.
read in.
B.
And I can't see the keep in mind I can't see the chat group. So just go ahead and tell me what it is.
I would say B.
B.
B. I would 100% agree with you. B. Number 2, you see an infant capable of reaching out to people and drooling. This is most likely what age group?
A.
B.
This is a tough one.
A or B.
C.
B.
4 months.
All of the above?
All right. So the correct answer is, again, like I said, you see this on the
4 to
quiz,
6 months.
is C.
Nice.
So you're 4-month-old.
So
Right.
4-month-old rule.
Yeah, the drool. Not to be confused with lethargy and excessive drooling, because that could be epiglottitis.
Yeah.
Okay, which is very dangerous. We'll cover that in pediatric assessment. All right. Number 3 is an infant who is repeatedly rejected experiences what type of attachment?
B. B is in boy.
B.
Yeah, correct answer is B. Good job.
Yeah.
Let's go number 4. Maybe. All right. Why do colds develop so easily in toddlers and preschoolers?
D.
I would say
D.
D. All of the above.
D.
Yep. Kids get sick and they bring it home and make us even more sick.
Mm-hmm.
Yeah. Well, germ.
But I don't have them.
Here we go. Pulse rates. Pulse rate of a toddler.
A.
I say B
A.
or C.
A.
B.
All right. 90 to 150. B.
You said a toddler?
Toddler.
This book says 90 to 50. Toddler.
90 to 50?
90 to 150.
Yeah, it's
Yeah,
B.
B.
Yeah, B.
Oh, I thought you said C.
C.
All right.
Oh, sorry about
So,
that. Let's see. Number 6. A school-aged child looking for approval from his peers and society is demonstrating what kind of reasoning? Looking for approval from his peers and society.
B.
B is
Yeah.
a conventional reasoning.
Conventional.
Yeah, conventional. Exactly. Self-concept is what?
B. No, D.
Everybody agree with D?
Concept. Yes.
Self
Originally it was B, but
Self.
I think it's B.
self-concept.
Isn't it A? Our concept.
feel about ourselves,
Perception.
self-concept. Oh,
How we
A
feel
or
about
B?
A.
A.
How we perceive ourselves. So think of self being us, ourselves, right? And the concept of how we perceive things. Why should you be concerned about a 16-year-old patient who seems depressed?
C.
C.
B.
The correct answer is C. Remember, I mentioned before, 16-year-olds have a higher rate of suicide and depression.
I'm so glad my kids are past that age.
Mine's
Me
7,
too.
so I'll figure it out here soon. Why do finances become an issue during mid-adulthood?
A.
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 Yep.
A.
They're taking care of parents and children.
Ugh.
And number 10, why is breathing more labored intensive for the elderly?
D.
D.
Yeah.
D.
Oh,
All of them.
I have D and B.
I would
I
say
would
D.
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 D. All
D.
the above.
All the above.
Yeah, all the above. Nice. All right, let's go back at 7:30.
Okay.
Change everything over here. Stop the recording and whatnot.